is at the anal verge. This is up above the dentate line. And the patients are unprepped, not NPO. They're just rolled over on their side. Most people have 3 hemorrhoidal columns. If you're on your left side, so you got left down, right up, anterior and posterior. The left lateral's down here, right anterior and right posterior. Wow. So if we put this in so that the ridge is at the anal verge, and if I just point it this way, it's going to get the left lateral tissue. Because we're not pressing on it, and we're just sort of setting it in there and pointing it in that general direction, when you put suction on this, only if there's a bunch of redundant stuff will this pick it up. And so people are always wondering, am I going to get the right stuff? You almost can't help but get the right stuff because it's all swollen, it's all stuck in the lumen, and it's getting in the way. So if I want to do the left lateral, I'll do this. If I want to do the right anterior, I point it in this direction, and the right posterior back here. When we insert this, and I'm going to keep my finger here to make sure this is at the anal verge. And now when I draw back on this syringe, you see how the thing bounces back? So I know that there's tissue in the end, even though I'm not looking. There's a locking ring right here, so I pull it back until it locks, and now I've got all the suction I need. The next thing I do is I'm going to twist it 90 degrees in either direction, and at that point, they say that that's to loosen up some additional soft tissue to come in there, but really I use this as a check to make sure that you're not too close to the dentate line. If the patient feels a pinch when you do this, then you're too close to the dentate line. And then you deploy the band, and you can just push it off. I don't do that. That's how I started doing it, but I had more misfires than I liked. So I actually hold the sheath still. I use this flange as a pivot point, and I use these 2 fingers to pull this back, and you may hear a little click, and then a suction sound. And I don't know which one of these it was. It sounded like a big suction, so I would imagine it would be this one. You then check it with your finger to make sure it moves freely. This one doesn't move quite as freely as I like, so I just go ahead and, with my finger, just advance it a tiny bit. That will move the band and cinch it down, and now it moves really freely. So I only have mucosa and submucosa, and the procedure's done. You have the patient wait around for 2 or 3 minutes to make sure that they don't sense a pinch. If they have a pinching sensation, then you need to adjust the band a little bit more. If they don't have a pinch, they'll generally just feel pressure or feel like they have to move their bowels. And if that's fine, then you send them home. We tell people not. That was kind of one of those. I think the Broadway is.